keep calm and watch this video. This is Doc Marl at your service.
Doc Marl. Some viewers may not know the meaning of prophylaxis. So, what does prophylaxis for COVID mean?
It means any medication or treatment used to prevent COVID disease from occurring.
So, can I use ivermectin for COVID prophylaxis?
Before I answer your question, Rosie, allow me to discuss briefly if there are studies that would support the use of ivermectin in COVID prophylaxis. The first study that ivermectin promoters would often quote is an ecological study, published in the International Journal of Antimicrobial Agents. This study shows low incidence rates of COVID in countries that implement prophylactic chemotherapy using ivermectin compared to countries that don't. Like other descriptive studies, this article has serious limitations. It cannot explain whether the observed low incidence rate was due to the ivermectin prophylaxis or low detection of COVID cases. It could also be due to effective implementation of COVID mitigation measures. Therefore, this study could not provide conclusive evidence in the use of ivermectin for COVID prophylaxis. Next is a prospective cohort study, which aims to determine the prophylactic role of oral ivermectin in preventing COVID infection among healthcare workers. The study showed that healthcare workers who had taken 2 doses of oral ivermectin have a significantly lower risk of contracting COVID-19 disease during the following month. The serious limitation of the study is that, at the end of the 1-month study period, RT-PCR testing was only done among healthcare workers who either developed symptoms or who were direct or high-risk contacts of positive patients. This will exclude healthcare workers who may have been asymptomatic or mildly symptomatic and chose not to get tested. This detection bias can significantly distort the outcome of this study because blinding was not done. Healthcare workers who took ivermectin and those who did not may have changed their behavior as a result of knowing what their group assignment is. This will also limit the validity of the study results. Based on these observations, the results of this study could not provide strong evidence in the use of ivermectin for COVID prophylaxis. A randomized controlled trial, published in the Journal of Clinical and Diagnostic Research, was done to evaluate possible role of oral ivermectin as a chemoprophylaxis in asymptomatic family close contacts with COVID-19 patients. The study showed less incidence of COVID-19 in the ivermectin group compared to the non-ivermectin group. The results of the study, however, were not conclusive because of the following flaws. First, few participants were enrolled in the non-ivermectin group compared to the ivermectin group. Second, not all of the study participants were tested for RT-PCR at the beginning and the end of the study.
So, is there convincing evidence to support the use of ivermectin in COVID prophylaxis?
Up to now, there is no study that provides unbiased evidence for the use of ivermectin in COVID prophylaxis.
So, why is there a lot of low-quality studies published in the internet?
One probable reason is hot stuff bias. When a topic is fashionable, investigators may be less critical in their approach to their research, to the point that investigators and editors may not be able to resist the temptation to publish the results.
Why is there a lot of people convinced to use ivermectin for COVID prophylaxis?
One probable reason is rhetoric bias. Researchers persuade readers without appealing to reason or evidence. Some ivermectin promoters speak or write articles designed to have impressive effect but lack meaningful content or evidence.
Is it safe to take ivermectin? To protect myself from COVID?
Ivermectin, at usual doses, does not enter the central nervous system. But after large doses of the drug, it may enter the brain and cause encephalopathy. Since there is no established human dose of ivermectin either for prophylaxis or treatment of COVID, this drug is not safe for use. The unsupervised use of this drug may lead to overdosing and other harmful practices. Well-designed clinical trials are needed. To be sure, ivermectin is safe and effective in people with COVID.
What will I do to protect myself from COVID?
Wear a mask that covers your nose and mouth. Stay 6 feet apart from others who don't live with you. Avoid crowds and poorly ventilated indoor spaces. Wash your hands often with soap and water. Use hand sanitizer if soap and water are not available. Get a COVID-19 vaccination when it is available to you.
Thanks, Doc Morrow, for your patience in answering my questions. May God bless you and keep you safe always.
Thanks for watching. See you in my next video episodes. Goodbye.